I'm joined by our new Chief Medical Officer, Dr. Gerald Maguire, who is not only a leading psychiatrist, but is also an experienced clinical trial investigator. Let's start by discussing the adherence issues and specifically in mental health. What role, in your opinion, does medication adherence play in treating mental health? And what has your experience shown you about the risks of non-adherence in this field?
The core to the foundational treatment of mental health for many of our conditions that we know, especially our most serious conditions that we treat, like schizophrenia, bipolar, is medication adherence. That's really the foundation for that. And then the rest of the therapies are on top of that. We do know that, unfortunately, just by nature of these conditions themselves, medication adherence can be a challenge based upon the cognitive issues with the patients. We know that, unfortunately, over half of patients with schizophrenia struggle with medication adherence, about 56% of them. About half the patients with major depressive disorder as well, too. And by nature of the condition itself, with difficulties with attention, ADHD, over half the patients. I just spoke to an ADHD patient of mine last week, and she said, boy, that would be great if I had something to I always can't focus and remember. Then I'm gone. I'm at a meeting or something, and I forgot I didn't take my medication. And of course, a really huge unmet medical need for us still is Alzheimer's as well. Dementia due to Alzheimer's, or over 40% of patients struggle with medication adherence.
No,
So
that's great. No, thank you.
yeah,
It's clearly a significant issue. One of the things you mentioned as well was in ADHD, and it strikes me that a lot of ADHD often manifests when patients are a little bit younger, and patients heading off to college. That's a concern for parents. What role have you seen any of that?
Oh, I've seen a huge amount of that is just in my own patients, and that the parents even playing a role, trying to call them, text them, hey, take your medicine today, especially if it's just been a whole field about trying to get a medication with a delivery system that would last all day and other things like that. So some patients come back and say, well, that's not quite as effective for me. I need to get that shorter acting one in the middle of the day in order for me to really be on my game. So parents struggle with that. Patients themselves, I've really asked for something that would help them because of the condition itself, where they have difficulty maintaining that attention. I always tell my own residents, and I know my patient really has ADHD, when they forget the appointment. Not forget, I clear with them. My staff says, you're meeting Dr. McGuire, especially I've established in-person care. Now I'm trying to do a Zoom to make it easier for them, or I'll tell them, and they're 15 minutes late, 10 minutes. But I call them like, oh, doc, I did write it down. I didn't. Then I like, this is really what my patient is. So, and we know that these high rates of non-adherence, they can lead to, these progression of symptoms, a lack of response, a reduced effectiveness. And especially with ADHD, we talk about that really it can be life-changing if the individuals, when they're off to college, and if they struggle with their academic performance, even in high school, we know as well too, or even it sets up that stigma, that negative thought process about this individual. I can't succeed here. We know, unfortunately, they may then have poor responses subsequent to therapies. So it's a vicious cycle where the non-adherence does lead to a worsening symptoms, a lack of response, and then a further decrease adherence overall.